Hello, good morning, good afternoon, good evening. Welcome wherever you are. Again, we are in Together We Do Better. Today we're going to speak about gestational diabetes. We started to talk about it in the previous post. And why is it important? Important because it affects, rather than one person, two people, mother and baby. And the reason we wanted to talk about it because we wanted to make sure the pregnancy is safe and we don't want to have any side effect of this into the baby. So when we say gestational diabetes, what does that mean? It means it's a diabetes during pregnancy in someone who never had a history of diabetes, or sometimes it can happen in the mums who had a diabetes during previous pregnancies and then they recovered very well. Right, so who can have a risk for gestational diabetes? So the mothers who had a previous diabetes during pregnancy, they are at risk. Moms who give birth for a baby who weigh 4.5 kilograms or more. Mother who has a high BMI or their weight is high, so BMI above 30. Mothers above age of 40 years old, they are at risk. If you have a family history of diabetes in one of your parents or your siblings, that again could be a risk factor for gestational diabetes. If you previously were overweight and had weight loss surgery or bypass surgery, or if you're from a background of African, Black, Middle Eastern or South Asian, they have higher risk than the Caucasian people. How the gestational diabetes present? Mostly it has no symptoms at all and it can be discovered during the antenatal visit and the routine test. Sometimes when the blood sugars are very high, they can present with the same symptoms of increased thirst, weight loss or tiredness, blurring of vision, or going to the toilet more often. So, why is it important for you to know if you have a gestational diabetes? Because the baby can grow very fast if the mother is diabetic. And that's one of the risks, because the glucose or the high blood sugars, it feed the cells of the baby. Then the weight increases quite significantly than what it should be in a short period of time, which can lead to premature labor. It can cause, in some cases, stillbirth or premature birth. So the baby can be born before he completed term. In terms of the treatment of gestational diabetes, the blood sugars need to be very tightly controlled because the time is very crucial. The high blood glucose, more time, rapid growth of the baby. So we need to make sure we control things quite tightly in a short amount or period of time. The control, it can be done through diet and exercises, tablets, or insulin. In terms of the gestational diabetes per se, it can resolve after the baby delivery immediately, or in some cases where they discover the mother is diabetic. During the pregnancy, she might have diabetes for a longer period of time, but she wasn't aware, and this is what we call it type 2 diabetes. Then she might need to stay on treatment after baby birth. Planning is very important, and to be engaged with the team earlier on, because the delivery need to be planned beforehand, and your team can be able to guide you whether you will need to be delivered normally or there is a need for cesarean section. And also it will be important for the team to tell you about the perfect timing or the time for delivery. Is it at 36 weeks, 38 weeks or whatever? So they will discuss that with you. But it's very important to be aware when to look for the gestational diabetes, who's at risk, and why it's important to have a very good tight control of the blood sugars. I hope this is useful. Stay tuned and we'll speak to you soon. Bye.